Hello, my name is Shannon Lienert and I'm a medical science liaison here at NS Pharma. Today I'll share with you clinical information on VILTEPSO, specifically our Phase 2 clinical trial, our Phase 2 open-label extension study, and our Phase 2 clinical trial for ambulatory and non-ambulatory males with DMD who are amenable to exon 53 skipping, known as the Galactic 53 study. While NS Pharma is not a publicly traded company here in the US, our parent company, Nippon Shinyaku, is publicly traded in Japan, and therefore the content on this slide acknowledges that we will be making forward-looking statements in this presentation. VILTEPSO is indicated for the treatment of DMD in patients with a confirmed mutation of the dystrophin gene that is amenable to exon 53 skipping. It was approved under accelerated approval, and I will show you the data to support that approval in a minute. The recommended dosage is 80 milligrams per kilogram of body weight, administered as a once-weekly hour-long IV infusion. Please see the VILTEPSO full prescribing information for more details or speak with your doctor. Some important safety information. In clinical studies, no patients experience kidney toxicity during treatment with VILTEPSO. However, kidney toxicity from drugs like VILTEPSO may be possible. Your doctor may monitor the health of your kidneys before starting and using treatment with VILTEPSO. Common side effects include upper respiratory tract infection, injection site reactions, cough, and fever. We will begin by discussing our Phase 2 clinical trial. This is the study design for the Phase 2 study. 16 male participants with DMD were enrolled in a randomized double-blind placebo-controlled 4-week safety period of once-weekly infusions. 2 participants were on placebo in the 4-week period, which was done to assess for safety. 8 participants were on 40 mg per kilogram, the low dose, and 8 participants were on 80 mg per kilogram, the FDA-approved dose of VILTEPSO. This was then followed by a 20-week open-label period to assess the efficacy and safety of VILTEPSO. Shown here are the study details. The study enrolled ambulant boys aged 4 to 9. Participants were on steroids at baseline. Participants received a once-weekly IV infusion of VILTEPSO for 24 weeks, and the primary efficacy endpoint was change from baseline in dystrophin levels. Participants could then continue into an open-label extension study for up to an additional 192 weeks. The secondary endpoints measured included exon skipping, dystrophin localization, and motor function. Motor function was tested with the North Star Ambulatory Assessment, Quantitative Muscle Test, Time to Climb 4 Stairs Test, Time to Run, Walk 10 meters test, and Time to Stand from Supine test. This slide demonstrates the change in mean dystrophin levels. The grey bar shows the dystrophin level before treatment at 0.6% mean change from baseline. The blue bar shows the mean change from baseline of dystrophin levels at week 25 at nearly 6%. These results were statistically significant as all participants showed an increase in dystrophin levels from baseline. This graph demonstrates that all participants exhibited an increase in dystrophin levels from baseline. We will now discuss motor function assessment. On this slide are the results from the time to stand from supine motor function test from the 24-week study. The VILTEPSO group is shown in blue, and the historical group is shown in yellow. At the end of the 25 weeks, the VILTEPSO group time to stand value was negative 0.26 seconds mean change from baseline. The time to stand value for the historical controls was 0.74 seconds mean change from baseline. Here are the safety data including common adverse reactions, which include upper respiratory tract infections, injection site reactions, and cough. There are no treatment-related serious adverse events, no discontinuations or deaths. We will now be discussing the Phase 2 open-label extension study. After completion of the 24-week study, patients could enroll in up to a 192-week extension study, 216 weeks total. Efficacy assessments were conducted every 12 weeks, and all participants opted to participate in the open-label extension study. The primary outcome that was measured was time to stand, The secondary outcomes that were measured include time to run, walk 10 meters, time to climb 4 stairs, North Star Ambulatory Assessment, and the 6-minute walk test. Shown here are the motor function data for VILTEPSO and an external natural history comparator group from the Synergy DNHS registry assessed over 4 years. On this slide are the results from the time to stand from supine motor test. On the right are the data in seconds. Note that VILTEPSO is in blue and the DNHS historical control group is in yellow. At the end of the 4 years, the VILTEPSO group time to stand value was 2.7 seconds mean change from baseline. The time to stand value for the historical controls was 8.3 seconds mean change from baseline. Shown here is the safety profile over 4 years of treatment. 3 participants reported a total of 4 serious adverse events, none of which was considered related to study medication. These included broken left tibia and fibula, broken right femur, rhabdomyolysis, and left tibia fibula fracture. Here is a more detailed look at the safety profile of VILTEPSO over 4 years of treatment, of which include cough, nasal cavity swelling as treatment-emergent adverse events. Now we will be discussing the Phase 2 clinical trial for ambulatory and non-ambulatory males with DMD amenable to exon 53 skipping. This trial is also known as Galactic 53. 20 participants with DMD were enrolled in an open-label study and received once-weekly infusions of 80 mg per kilogram of VILTEPSO for 48 weeks, which then had a post-treatment visit as well as a 30-day follow-up. Participants were matched to a Synergy Duchenne natural history cohort based on age, ambulation, and steroid status. Shown here are the study details. Both ambulatory and non-ambulatory boys aged 8 or above and who were amenable to exon 53 skipping therapy were participants. They received a once-weekly IV infusion over a 48-week period. The primary endpoint was to measure the safety and tolerability of VILTEPSO. The secondary endpoints were to measure both lung and motor function. Lung function was measured by forced vital capacity, also known as FVC. FVC is a breathing measurement that tells us how much air you can blow out of your lungs after taking your biggest, deepest breath. The FVC is the difference between the maximum air breathed in and the maximum air breathed out. Motor function test was assessed using Performance of Upper Limb 2, also known as PUL-2, which assesses motor function using a series of tasks such as moving and lifting weights and raising the arms above the head. The study also included mid-level elbow and total score. The total score includes shoulder movement, elbow movement, and wrist movements. Lung function, or FVC, was assessed at week 49. Ambulatory participants taking VILTEPSO showed an 8.3% mean change from baseline. The historical group showed a 1.2% mean change from baseline. Non-ambulatory patients taking VILTEPSO showed a 1.6% mean change from baseline, and the historical group showed a negative 3.2% change from baseline. Motor function was assessed using PUL-2 over time. There was no historical data to compare to. In both the ambulatory and non-ambulatory participants, the PUL-2 total score and mid-level elbow score had minimal changes from baseline throughout the 48-week study. Here is the safety data. There were a total of 4 treatment-related adverse events, which included 2 cases of hematuria, which is blood that can be found in the urine. Sometimes you're able to see it and sometimes it is only found on a test. Other treatment-related adverse events include 1 case of an allergic reaction and 1 case of hypertension. I wanted to take a moment to thank all of the participants, their incredible families, and the healthcare professionals who've made these studies possible. For questions related to VILTEPSO, please call 866-NS-PHARM, and our fabulous patient support team can be reached at 833-NS-SU-PRT. Thank you so much.